Before we get into the specific information on health literacy, I want you to test yourself. We tend to use a lot of abbreviations in our field, and I'm curious how many of these you recognize and can define each of the letters with the correct term. So let's test some out. HDL, HSV, BSE, MRI, PID, PAP smear. What does the PAP stand for? And here are a few more. So these are about 30 fairly commonly used abbreviations. Some of them do have multiple meanings, but I'm curious how many of these you could state what the abbreviation stands for. As we remember from oral communication, when we use the example of THC, we may be asked, what does that stand for? But again, when it comes to literacy, if we are using these freely and not providing the explanation, that can present difficulty for our readers of print material as well as our audience members in our presentations. So understanding literacy. Literacy is more than just reading. We need to keep in mind that it's also writing, basic mathematical calculations, speech, and speech comprehension. So this applies to print material, but as well as our presentation materials. And here we have basic print literacy, but then also the additional functional literacy of being able to apply information to perform particular tasks. When we look at literacy in the United States, these statistics are from 2014. This is a 10-year study that is completed in cooperation with the National Center for Education Statistics, surveying adults aged 16 and older. When we look at these numbers, non-literate refers to someone who cannot read well enough to perform activities of daily living, nor could they complete a test on literacy. When we look at below basic and basic, ranging in age from 1st to 5th grade reading level, that is almost half of our adult population. Then for intermediate, 36%, approximately 6th to 8th grade, and then the proficient readers, high school and above. For this particular year when the survey was completed, it was the first time that they had taken the two highest levels and combined them. Globally, there was less than 2% of adults that were at a higher than proficient level. So in this case, they did combine those. So that does represent high school and above. So when we're preparing, again, our presentation information, but also our print messages, our social media messaging, we do need to consider who the recipient of the message is. If it's for the general population, what grade level, readability level should we aim for? However, when we know that we are working with high school students or with college students, we can tailor the message more to their level. So how does this then compare general literacy to health literacy? Health literacy focuses on the use of information, health-related information, to make decisions and take action related to our health. Now, we recognize that someone with lower literacy in general is likely to have lower health literacy, but health literacy is also very complex because we do see that individuals with higher general literacy may also experience or report a lower health literacy. We know that individuals with lower health literacy are more likely to go to the emergency room, have more hospital stays, less likely to follow treatment plans, and also have higher mortality rates. So what is it about health literacy that makes it so different? I mean, think about the content, the topics that we provide information about. How is that different than other contexts of information? Think about how you feel when you go to the doctor's office. One, we may not be feeling well, so we may not be concentrating as much, but we go in there and the doctor starts explaining our situation, giving us the prognosis, giving us directions for taking care of symptoms and following instructions for medication. How do we feel when we leave the doctor's office? Have we asked all the questions that we wanted to ask? Have we asserted ourselves in making sure that our healthcare provider clarifies everything for us to our understanding? Or do we walk out sort of in a fog and reflecting on, oh, I think this is what was said? That's the way most people experience this sort of situation. So oftentimes there's stress and fear connected to the information that we're receiving. We're dealing with unique conditions, physical, mental impairments potentially. There's a lot of specialized jargon, terminology, anatomy, physiology, bodily functions and processes that maybe we don't fully understand. And that's why somebody with a fairly high or higher general literacy level may still report or indicate a lower health literacy because it's out of the context that most of us are working within. So Healthy People 2020 did address objectives and goals related to health literacy. We do have a national action plan to improve health literacy. Part of this national action plan included the development of the Clear Communication Index, which we will be using in Health 420 as part of the health literacy assessment of the newsletter. The CCI was developed in large part by the director of our own Center for Health Literacy in the School of Public Health at Maryland. Dr. Cynthia Bauer was a leader in developing this index. We also have the National Assessment of Health Literacy of American Adults, surveying and tracking where people fit with understanding health-related messages. And then even prior to all of this, we do have the Federal Government Plain Language Act of 2010, and those guidelines stemmed from efforts going back to the 1990s. So we are making headway and making improvements in this area. But what action can we take for closing the gap for health literacy? It is a three-pronged approach. So think about what are the three things, individual, different direction approaches that we can take to close the gap. You will be part of developing more appropriate written materials, and that's one of the reasons why we have the newsletter assignment for Health 20. Improving the skills of those with limited literacy. Unless this is a personal interest of ours, we may not do specific work in improving literacy in general, but that too will help close this gap. And then as far as our healthcare providers, making improvements in their communication skills. Again, we are part of the sort of within the umbrella, if you will, of healthcare providers. So of the three-prong approach, there are two specific ways that we can work, put effort into closing the gap. So what's involved with developing appropriate written materials? So we do have some basic quick rules. We want to consider the terminology that we're using shorter, easier words and sentences. We want to have an active voice. This is a very different style of writing than the typical quote-unquote professional writing that you typically do for most of your assignments. Literature reviews are not written in the active voice. An active voice is when the reader is the subject, but it also allows for a more conversational tone, a little bit more inviting. And we want to make our writing personal and concrete. We tend to, in our field, refer to concepts more than specific concrete ideas. So this may be another shift in our thinking. Try to remove unnecessary words and focusing on that welcoming tone. When we're writing our newsletters, when we're sending, developing social media messages, it's okay to use personal pronouns and again to have that conversational tone. In the format of our print material, such as a newsletter, we want to break down our information into headings and subheadings or subtitles to help give the reader direction and focus. We want a degree of repetition without being redundant. It's always nice to have a creative appeal to it. The newsletter would be something that, somebody may be walking past a display rack and we want them to see it. We want someone to pick it up and read it. Creative appeal will assist with that. And just like with our presentations, having some interaction, we can still have interaction with our readers. So let's look at shorter, easier words. Most of us look at these words and probably don't think twice about how we would rephrase it or other terms to consider. But let's look at a few. Physician. What other wording could we use that might be simpler? Doctor. Healthcare provider. Healthcare provider allows us to encompass physician assistants, nurse practitioners, technicians. So it's a little, more inclusive as well. Immunization. Some people immediately think vaccine, but is that really a simpler term? What is an immunization or a vaccine typically? It's a shot. So using that term in association with immunization and vaccine lets the reader or the audience know exactly what we're talking about. Here's an interesting one. Life-threatening. Are you thinking dangerous, serious, deadly? Do all of those words really provide a very clear, concrete, specific indication of how severe a situation is? What about the phrase, you could die? Now, you've probably just chuckled or been a little shocked with how direct that phrasing is. But I know from personal experience, when my mother-in-law has had various health situations that have been life-threatening, and we are trying to emphasize to her how important drinking water is, to stay hydrated, to take her medications properly. We have put in a lot of safety nets to ensure all of this. But prior to that, we would keep saying, this is a dangerous situation, this is life-threatening. But until she heard the words, you could die, everything just sort of got brushed aside. She heard those terms, and all of a sudden she was like, oh, well, I don't want that to happen. I'll have to make some changes. So again, sometimes we use more euphemisms, conceptual terms, when we really need to be very clear and precise. Using an active voice. Again, the active voice is when the reader is the subject. In this case, it's written passively. Seatbelts must be worn by everyone according to state law. What is a more clear, concrete way to phrase this in an active voice? Everyone must wear a seatbelt. It's the law. No one can really question that. Who needs to wear it? Everyone. Why do I need to wear it? It's the law. Here's another. Your doctor's advice should be followed. Instead, active voice, follow the advice of your doctor. The subject is the assumed you is the subject. Now, speaking of concrete messages, let's try this one. Good nutrition is essential to good health. Well, what is good health? How do people perceive good health? Most of the time it's, I'm not sick. It's not so much, I have a great quality of life or a good quality of life. It's, I'm not sick. Okay, so I don't want to be sick, so I need good nutrition. What is good nutrition? Some people would say it's healthy eating. Well, what is healthy eating? Some people would say it's a balanced diet. A balanced diet. I look at my plate, it's a circle. I need it to be balanced with the food, and I want it to be good. So I do half a plate of mac and cheese and half a plate of chicken tenders. Balanced diet. And then we look at it and go, some people might say good nutrition is good food. Well, again, what is some good food? Chicken tenders, mac and cheese. That is not the message that we're trying to convey here. Instead, rewrite it. If you want to stay healthy, eat more fruits and vegetables and whole grains and less fat and sugar. Do you want to stay healthy? Yes, I want to stay healthy. If I want to stay healthy, what do I need to eat? Fruits, vegetables, whole grains. What do I need to eat less of? Fat and sugar. A more concrete message. Now, let's avoid unnecessary words. Because influenza viruses change often, it is necessary for those at risk to get a flu shot every year for protection against the virus strains that are expected that year. Whew, that is a mouthful. Instead, if you don't want to get the flu, get a flu shot every year. The flu virus changes often, so last year's shot won't protect you this year. One, it starts off by appealing to us, I don't want to get the flu. So what do I need to do? I need to get the shot. Well, I got a shot last year. That one won't protect you this year. Much more clear, concise, and concrete. So let's also make sure we use a welcoming tone. Instead of, you must fill out these forms prior to your appointment, change it to, if you fill out the forms before you come in, we can take care of you faster. Isn't that something we all want? So as we're preparing our messages, print material, specifically in this case, but also our presentation materials, we want to make sure that we are clarifying the point that we want to make. In print material, what is it that's making a sentence hard to read? Do we have too many prepositional phrases and clauses? We can also try to talk out the point, focusing on that conversational language. And then as we edit and rewrite, each time it should become easier to read. Now, keep in mind that easy to read doesn't mean we lose integrity of the message we're trying to convey. We don't need to make the message too simplistic. So we don't want to have a knee-jerk reaction in simplifying it, especially when we know or have some indication of the readability level of our reader. If we know we're working with high school students, then keep in mind the level of reading for high school students. If we know we're working with college students, understand their level of readability as well. So here we are back at the health-related abbreviations. So I use the example HDL, high-density lipoprotein, HSV, herpes simplex virus, BSE, breast self-exam. We then have TSE, testicular self-exam. I pulled up MRI. Many of us probably recognize what that machine looks like. We know that it makes a lot of noise. But if we're asked, would we be able to respond? Oh, MRI stands for magnetic resonance imaging. And it's because of the magnetics in the equipment that makes it so loud. Now, I also asked about Pap smear. Pap, in about the past 15 years or so, since we've really known so much more about the connection between cervical cancer and human papillomavirus, people think Pap is short for papilloma because of that connection, but that is not the case. Pap is short for Papanicolaou. It was Dr. Papanicolaou back in the 1940s that identified irregular cervical cells in mice and then created the screening test that could then be applied to women for detecting irregular cervical cells. And that is done during the Pap smear part of the yearly pelvic exam. So if you haven't learned anything else in this class, at least you learned a little bit of trivia there. So you can read through the rest of these. The main thing is making sure that we don't use these without providing proper information about what they stand for. And now you can follow up with additional information about the newsletter assignment.